Good afternoon, sir.
How are you, sir?
I'm very well. How are you? That's the question.
I'm actually healthy, and the reason I'm here is that we need to consider that the American medical system, our national healthcare system, is at risk if we allow immigrants from other countries who are sick to come in and compromise our medical system. We cannot help the West Africans unless we are healthy ourselves.
Well, you said an interesting word. You used immigrants. How about people that have been to Africa who are American citizens and they're flying back from those hot zone areas, and some are even flying through what we call now gateway cities in Amsterdam, Belgium, etc. How about them? Would you recommend that they stay away, or can they come back to their homeland?
I would actually be in favor of everybody who wants to travel to the United States be in some sort of regulated quarantine for almost a month. And if they really want and need to be here, they probably should be willing to be in a quarantine situation. If they've chosen voluntarily to be over in West Africa, they need to understand that this disease is a threat to themselves, and it's a threat to the entire United States. I mean, we have 300 million people here. We could have an epidemic in the United States that rivals West Africa. And if our American medical system is compromised to the point where we can't take care of our own, how are we going to be able to help the West Africans or anybody else in the world who has an outbreak of this epidemic?
Certainly, there's a lot of Americans who believe in exactly what you're saying. There's others who believe that we need to send folks there who are able to assist individuals in country, who then can help them get better, so then they can pretty much knock out the disease. Can I ask you your name and what organization you represent if you do that?
I'm Jeff Hulbert. I'm from Annapolis, Maryland. I'm a private citizen who believes it's time for a temporary delay in airline flights from West Africa until we can get a handle on this epidemic. I know I and other Americans, we think we're generous, and we would help donate money for the charter flights that are necessary. We would encourage our tax money to be used for military charters to bring medical people and supplies in and out of the affected regions. It's not that we want to be mean, we want to be smart. We can't help them unless we ourselves are healthy, and the best way to do that is the number of charter flights they say they need, we'll get them.
Okay, now here's the question for you.
Sure.
Just today, the president announced that he was appointing a head of the Ebola Response coordinating individual, the head of the Ebola Response team.
Ron Klain.
Ron Klain, a former political
operative.
Worked on the Gore campaign in 2000, who also was Vice President Gore and Vice President Biden's chief of staff.
Right.
Now, is that comforting to you that the president has put someone in charge who seems to have a good managerial expertise?
I'm not sure if a doctor should be in charge of a political operation or if a political operative should be in charge of a medical operation. I think he's not qualified to do this work. I think President Obama is not showing leadership in this very important medical crisis by appointing a political operative. It's one thing if they need somebody to come in who's a real good communicator, because if Obama's too busy to communicate, maybe let's bring another communicator in. We need really to get politics out of these medical decisions.
Well, this is 2 weeks before midterm elections. So do you think that factors in at all, sir?
The Ebola crisis was not timed to any election, and we can't help it that it's happening now. Americans, it's not that Democrats' health is at risk or that Republican health is at risk. It's that American health is at risk. And yes, there is an election coming in a matter of weeks. It just so happens this epidemic is happening now. We need to face it with an American plan, not a political plan.
Do you think this American plan should be coordinated with our European allies?
Oh, sure. This should be a global thing. This is one big global neighborhood. I was talking to school kids earlier. I was telling them, if you have the flu, you just are not going to be going to your friend's house for a week. But later, after a week, you'll be invited back to your friend's house. I'm telling you, we're saying to the West Africans, you are welcome to visit and live in the United States and conduct commerce in the United States. We're just asking for a temporary halt until we can get control of this epidemic.
Well, I thank you very much.
Great.
We had a very interesting interview here on News to Share. Thank you, sir.
Thank you.